There's a chance somebody you know might need an organ transplant one day.
More than 100,000 people in the U.S. are on the list right now waiting for a transplant, but many more can't get on that list. Eyewitness News reporter Mark Becker investigated and found oftentimes it comes down to money and insurance.
This is a story of life and death of two men and many thousands like them. Mauricio Larios Espinosa's heart is weak and getting weaker. He may need a transplant one day, but might not be able to get one. Because despite working here for 16 years, he doesn't have health insurance. I ask now if it's fair, he told me, because when I was working and paying my taxes, no one asked me if I had insurance. We don't know if anyone asked Jose Navarrete Garcia if he had insurance. The father of 7 was mowing a lawn near Lake Hickory in May when something went horribly wrong.
And he gets on this riding mower, and the next thing you know, he's in the lake. And they don't even know it. And he's in the lake for 15 minutes.
Jose was still alive when rescuers pulled him out of the water, but he died several days later at the hospital, and his family made the difficult decision to donate his organs. None of that surprises Paul Burr.
Always happy, always working hard.
Their stories underline a painful paradox for many living without health insurance, who can donate organs that they might not be able to receive. The decision of who gets on the list for an organ transplant and who doesn't is made by major hospitals called transplant centers.
What's your patient's last name?
We traveled to Richmond, Virginia, where the United Network for Organ Sharing, or UNOS, takes calls from centers across the country, matching organ donors with people waiting for a transplant. Joel Newman is the spokesman.
Certainly the transplant hospital is looking for the medical aspects. Is transplantation even a good treatment for this person? These are some of the...
Newman says transplant centers may also ask if the patient has a serious illness like cancer that would rule them out. And fair or not, they'll almost always ask about money.
Ability to pay is one of the factors. I mean, they will look at whether that person has private insurance.
And of course, this is life and death.
It certainly can be.
Here, hold Sissy's hand.
But even those who do get a second chance at life sometimes wonder if it's fair.
It took us probably 3 months to get on the list. It was very, there was a lot of paperwork, a lot of meetings.
What kinds of questions did they ask?
A lot about insurance.
Evelyn Pittman's daughter, Audrey, was only 6 months old when she got a new liver that saved her life. She's happy and healthy now. But Evelyn has seen the other side also.
I do know a couple people from home that are awaiting transplant that can't get on the list, due to mental health issues or, they don't have insurance. They still need that organ. I mean, no one should have to die waiting for a transplant.
Mauricio Larios Espinosa hasn't been able to work for 2 years, and his medical bills have been stacking up. He's still hoping for a miracle, but without insurance and with his name still not on that list, he knows a new heart may be too much to ask.
Now, there are 4 transplant centers in North Carolina. One of them in our area is Atrium Health. None of the people we talked to are Atrium patients, and Atrium tells us that Atrium Health follows all of the national transplant standards and regulations as outlined by the Organ Procurement and Transplantation Network and the Centers for Medicare and Medicaid Services, and is firmly committed to our mission to improve health, elevate hope, and healing, advance healing rather, for all.